Hi, good day. I'm Keenan Cruiser. Today we'll be speaking about the COVID-19 pandemic that's currently upon us, right? Here is the fatal truth about the coronavirus. It destroys you mentally before it ever touches you physically. One important aspect to take into consideration is that I fully understand that a mask has the ability to keep out germs. However, can it keep out depression? Can it keep out anxiety? How about suicide? I understand that soap has the ability to clean your hands, right? But does it have the ability to keep out negative, uncertain scenarios from helixing in your train of thought each day? If the answer is no, which I know it is, take some time out of your busy schedule and challenge yourself to be more aware of the COVID-19 pandemic that we face currently in South Africa today. I've incorporated an icebreaker over here, right? The icebreaker give you guys some sort of idea on how I deal with COVID-19 in my own household, right? I will be speaking about what I do before I eat, before I touch any surfaces within my household. I will be speaking about the homemade concoction in order to build up my immune system in order to combat COVID-19 in my household, right? I've designed over here a cardboard demonstration and illustration of some of the signs and symptoms of COVID over here, right? Most importantly, stay at home and be safe at all times, South Africa. As some precautionable measures, you wash your hands, you wear a mask, and you cover your cough when sneezing. Make a flexed elbow. This is a flexed elbow. Those are some of the germs over there. Alright, step one in my household, before I touch any surfaces, South Africa, is pour some water into it. Right? This is cold water right here. Can be any temperature of your choice, right? With my hands, and I have Dettol soap right over here, and as I do to clean my hands effectively and efficiently each day, right? I wash my hands for 20 seconds at least in order to get rid of the germs that I've contracted from any surfaces that I've touched, which is unclean. So I get in there, complete that. I use my thumbs over here, as you can see. I use my index fingers over there, the middle as well, and the ring finger, and my last, just to make sure everything is covered for 20 seconds, right? After that, I do a thorough rinse of my hands over there. You can see over there. Once I have completed, I have a cloth to dry my hands. And if you guys do not have any Dettol soap, or you guys are on the road and there's no water available, any soap, I do recommend some sanitizer, waterless sanitizer, up to 70% alcohol, so it kills the germs, right over here. Alright, moving on, we have my homemade concoction. Right? We have some garlic over here, we have some ginger over here, we have some lemon over here, then we have some Robertson's cayenne pepper as an additional powder, which is good for inflammation, right, within the body. Then we have honey. I use honey instead of sugar because it's healthier, right? So I have cooked water over here, right? And what I do is I place the cooked water in my glass over here, right? Once I have completed with that, I take my garlic over here. As you guys can see, I have my garlic over here. I take off the peel, I slice it in half, so it makes it more easier for the skin to come off. 4, and then I place it. See? Most importantly, make sure your working area is nice and clean. Then I use the ginger over here. I chop him and I add him into the glass. Over there, this is how it's bought at your nearest retailers and shop centers. Cut him in half over there. Place that right there. Everything is off. Slice it as much time as you feel is adequate enough. And you slice it in half. You put that in. Alright? Like I said, keep a clean working environment, right? As we can see over here, now I'm going to utilize my lemon. I have a normal lemon over here, right? You cut it. I normally cut it in 3 parts, right? The first part I dispose over there. Then we have the additional parts which I utilize for my concoction, right? The first section over there. I place it in over there. Then I have my second part. Get it sliced over there. And I have my third part that I sliced over there. Here we go. And I utilize some cayenne pepper from Robertson's for the inflammation. And I put it on a teaspoon. And I make the concoction, right? And I have the honey, so that the concoction is not as distasteful as you guys think it is. And I stir it over there. And I stir it like that. Over there. There you go. You can stir for 3 or 5 seconds or so. And once you guys are finished, this will be the end result of what it looks like, right? And once it is completed, cheers, South Africa. Testing will be required in order to establish the difference between the 2 illnesses, which is influenza and COVID-19. This will verify and confirm the diagnosis. Flu and COVID-19 share a numerous number of characteristics. However, there are various pivotal differences between the 2 illnesses. Meanwhile, more is discovered each day. There are still an extensive amount of unknown information regarding COVID-19 and the virus that causes it. On the second point of order of the pivotal questions, I would cover in the facilitator's guide about the COVID-19 pandemic would be what are the national statistics currently in South Africa and in each province, right? As of the 19th of July 2020, a cumulative total of approximately 364,328 confirmed COVID-19 cases in South Africa have been documented and recorded. This column over here points out the province. This column over here looks at the total cases of the 19th of July 2020. This column over here explains the total percentage of the total cases of 19th of July 2020. As we can see over there, we have the Eastern Cape, we have the Free State, Gauteng, KwaZulu-Natal, Limpopo, Mpumalanga, the Northwest, the Northern Cape, and the Western Cape. The unknown column is for the unknown cases that have not been documented, but people that are infected, right? And as we can see over here, there are 3 pivotal provinces that I am going to mention. That would be the Eastern Cape, Gauteng, and the Western Cape. You would ask me, why would I mention those 3 provinces if all provinces are infected? Those 3 provinces have the highest number of infection rates within the entire South Africa. Number 1 being Gauteng. Gauteng is at a whopping 133,617 cases, leaving the percentage total at 36.7. This is quite scary and it's dreadful results if you look at it. Number 2 in line, we have the Western Cape with 85,926 total cases, leaving the percentage at 23.6. Right? Third in line, we have the Eastern Cape with a whopping 63,181, leaving the percentage total at 17.3. Amongst these 9 provinces, we have the epicenter. The epicenter refers to the highest number of infections regarding COVID-19 pandemic. That would be Gauteng. Gauteng has the highest number of infected people within South Africa, with 133,670 from the 19th of July 2020. And might I add, this number increases by the second. And this is the total case data that I have accumulated and done extensive research about within each province in South Africa today. Right, we have the private and we have the public The public sector, just over a million people, more than a million people have been tested, right? Which leave the percentage at 43%. Then we look at new tests that have been conducted, which is 19,443 tests that has been conducted, which brings the sum total percentage of 40%, right? If you add the total number of tests that have been conducted, it will give you the 2.4 over here on top. And if you accumulate the new test in 9,006, right? And if you add the two percentages, you take the total test and you take the new additional test together, you get 100% right over there. The third segment that I would cover in terms of the national statistics of South Africa of COVID-19 pandemic are the reported deaths and recoveries. Right over here, we have the province, we have the deaths, and we have the recoveries. Right? I will be mentioning the three pivotal provinces infected by the virus, the number of deaths that are quite high, and the number of recoveries which are amazing. Regrettably, I can report and confirm additional 85 new COVID-19 related deaths has occurred. This brings the cumulative number of deaths to 5,033. I convey my sincere condolences to all the loved ones of the departed, and I salute all the healthcare workers out there who are working tirelessly to ensure all patients are impeccably taken care of despite the deceased numbers increasing at a rapid pace. The number of recovery currently stands at approximately 191,049, which ultimately translates to the recovery rate of 52.4%. So over here we have the lowest number in terms of the three pivotal provinces, which is the Eastern Cape, with a total deaths of 826. The total recovery rate is 44,317. Then we move along, we have Gauteng with 986 deaths, with the recoveries being 58,512. Then we move on to the top of the charts, right? The mother city, the Western Cape. The Western Cape has 2,619 people that have unfortunately died. However, the recovery period and the recovery rate goes to 68,410. If you add all the recoveries up, it gives you a subtotal of 191,049. If you add up all the number of deaths, it gives you a subtotal of 5,033. If you take all this data and you accumulate it in terms of percentage, our percentage based on our recovery translates to 52.4% here in South Africa today. There are more components to know about COVID-19. No one is immune to becoming ill once exposed to the virus. In case of severe or critical illness, the risk of complications increases substantially, and the complication can be life-threatening, right? There are currently 3 stages of COVID-19. As we look here behind me, we have the first stage. During the first stage, patients may experience smell or taste impairments, however frequently recover without any serious intervention or medical treatment. In stage 2 of the coronavirus, as we can see over there, a robust immune response is activated by the virus, which subsequently leads to inflammation within the blood vessels, as we can see over there, and it increases the hypercoagulability factors, right? And the formation of blood clots in the cerebral arteries and veins appear. The infected patient will most likely experience either large to small strokes. Additionally, in stage 2, symptoms include fatigue, sensory loss, double vision. In stage 3 of the COVID-19 infection, the cytokine storm appears in the blood vessels, as we can see over there, right? That becomes so severe that it causes an explosive inflammatory response and subsequently penetrate blood-brain barrier, which occurs in the top region of your brain, right? This leads to the entry of cytokines, blood components, and viral particles into the brain, where parenchyma causes a neural cell death, right? based on multiple reports in recent months, approximately between 36 to 55% of patients with COVID-19 are rushed to the hospital have some or other neurological symptoms. This, however, is not directly visible. As a result, patients should be monitored and carefully evaluated over a long period of time after they have been discharged, as they may develop some sort of cognitive dysfunction at a larger stage. Additional symptoms may include the following. May include nausea, vomiting, diarrhea, nasal congestion, coughing up blood and blood-stained mucus, intensely red eyes, watery discharge from the eyes, swollen eyelids, and light sensitivity. And as we can see over here, we have 1, 2, 3 symptoms of COVID-19, right, which includes the fever and the cough and the shortness of breath over here. So it's imperative for you guys to take note and take actual notes while I am conveying this message right over here. Moving on to the fourth component of the 6 pivotal aspects that I've mentioned in terms of COVID-19. These are some of the ways to prevent COVID-19 from being transmitted, right? You are required to wash your hands frequently with soap and water for at least 20 seconds, right? And if water is not available, utilize an alcohol-based sanitizer, right? In order to get rid of those germs that penetrate our hands, right? Each day. Avoid touching your eyes, your nose, your mouth with unwashed hands, as you can be a carrier of the germs and infecting yourself instantaneously, right? Avoid close contact with people who are generally sick, as it may weaken the immune system and enable you to contract any illnesses, right? So if you guys are sick, please stay at home. Stay at home when you are sick and strive to keep a distance from others in your home. Cover your cough and sneeze with a flexed elbow or use a tissue in order to sneeze and throw it away once you are done, right? Clean and disinfect frequently touch objects like your countertops, your TVs, your mobile devices and your laptops in order to eradicate the germ on surfaces each day. You may use Dettol, but Jig is the #1 cleaning aspect that will help combat COVID-19 on surfaces each day. Now we'll be moving on to the 5th segment. The 5th segment involves what occurs when you are infected with COVID-19. If anyone tests positive for the virus, they will be immediately contacted and notified by the healthcare professionals, and they will inform them to be placed under quarantine at home or at a facility designated to manage the outbreak. This self-quarantine period will occur for approximately 14 days. Self-isolation is a way to keep yourself from possibly infecting others in public spaces, to infect your relatives, your friends, your colleagues, and even people within the public transport sector, right? The infected individual will remain under quarantine until a repeated test indicates that he or she no longer have any signs or symptoms of the virus within their body. And we'll be moving on to the last segment of the pivotal questions of COVID-19. The last segment includes how COVID-19 is treated. You guys are in the dark of any treatment that is currently available, but let me be the light in the dark. Treatment is supportive, providing oxygen for patients with shortness of breath, which includes a ventilator to some individuals, or treating fever, for example. To date, there is no specific antiviral treatment available. Antibiotics do not treat viral infections. Meanwhile, antibiotics may be required if bacterial secondary infection does develop within your body. We have reached and ended the last segment of this assignment. I've included an exercise for you guys to do. The exercise will be based on what coronavirus is, what the national statistics are, which includes the death rates, the recoveries, what are some of the stages and symptoms of coronavirus, what are the additional stages of coronavirus, what are the severe stages of the coronavirus. It also includes some precautionable measures to take into consideration when you are infected or to prevent the transmission of the coronavirus. It will also include what does occur when you are infected. You should be placed under self-quarantine, what self-quarantine is, what self-isolation is, the period of time that it takes for you to be self-quarantine at home, and what treatment is available at the hospital when you are infected with the virus. Activity, this is quite a guideline to guide you in terms of the activity. It gives you some valuable information in terms of what the exercise entails. The activity is what is COVID-19. The outcome that will be covered is after completing this training intervention, participants should fully comprehend what COVID-19 is and what everything that it entails, right? The time and location for this exercise is approximately 1 hour. My job is to fully cover the content with you guys. As you guys saw throughout this video, I've covered it extensively, so you guys have a better understanding of what it entails, right? And the content that I will be covering is the full COVID-19 pandemic, which is the 6 pivotal questions of COVID-19, which includes what COVID-19 is, what's the difference between influenza and COVID-19, what national statistics are, precautionable measures, what occurs when you are infected, what treatment is available when you are infected with the virus, ventilators, oxygen tanks, so forth and so on. Some stages and symptoms. There are 3 stages. There are multiple symptoms that you have in terms of COVID-19, right? Training aids will be handed out to you guys, and as you don't understand, you can just look at the PowerPoint presentation for more valuable information on the pandemic of COVID-19. Question 1 is briefly discuss what COVID-19 is for 5 marks. Question 2, what is the total number of cases in each province from 19th of July 2020 for 10 marks. The third question involves what are the various stages and symptoms of COVID-19 for 6 marks. So you give me the 3 stages and you give me 3 symptoms to get you additional 6 marks, right? Over there. Question 4 involves what are the multiple ways to prevent COVID-19 from spreading from yourself to other people. So mention 4 ways that you can enlighten me how you can prevent COVID-19 from spreading, right? Question 5 is what occurs when you are infected with the virus. So you tell me what occurs and what precautionable measures can you take, when you are infected. That will gain you 3 marks. Last but not least, question 6, what treatment is available for COVID-19? So you speak about when you go to the hospital, what they will do with you. Will they put in a ventilation system? We go for oxygen tank. How would they treat your symptoms and make you feel revitalized again? And that was marks, right? And if you add all the totals up, you will get your 30 marks. I've came to the last segment, the total last segment of everything. Thank you guys for listening and tuning in. I know it's been a tough year for everyone. It's been quite uncertain times. But at least we're from level 5, we're on to level 3. The curve is back, but it's shifted. So we are able to move a bit more like around in the country. So thank you guys for everything. Any questions you guys want to ask me, don't forget to subscribe, hit the bell and like this video. Thanks so much for tuning in. I'm Keenan Cruiser, your facilitator on COVID-19 pandemic today.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider.